going to have you do, you can kind of come out this way because you're not going to do your legs. So you can do up and down like that. Perfect. And then extend your leg out like this. Perfect. All right, can you do back like that again? I'm gonna feel. All right. Thank you. All right. I don't feel any crepitation with that. There was full range of motion and both of those movements. And now I'm gonna have you do a shallow knee bend. So can you just bear with your knees like that? All right, you maintained your balance with that perfectly. And so now I'm gonna have you, I'm gonna have you do a duck walk for me, okay?
Okay.
Do you know what that is?
Yes.
Or do you want me to show you?
No, I know.
Okay, so can you do a duck walk just right across here for me and I can observe that?
Here?
Yeah, that's fine.
Okay.
All right, perfect. All right, you can get up. All right. All right, so you can pull your pants back down. Okay. All right, so full range of motion noted for all of those movements. You didn't have any pain with that. I didn't feel any crepitation, so that's good. And the movements were symmetric bilaterally. So now I'm just gonna have you go back here to the wall here, and I'm just gonna have you walk, and let me watch you walk. All right, you can go back, turn around, go back. All right, perfect. Okay, you can sit back down for right now. So her gait was smooth and even, and we had, so her gait was smooth and even. She moved, you moved as expected. You didn't have to have any assistive devices, or you didn't try to grab onto anything. You maintained your balance well, so that's good. Okay, and now we're going to move on to your ankles and feet.
Okay.
And I'm gonna just, can you take your shoes and socks off for me for that? Alright, then you can just sit up on the bed for me like this. You want to turn this on? Alright, thank you. You don't have to lay back or anything, but. Alright, now I'm just inspecting the ankles and the feet, and the ankles are in alignment with the rest of the leg, both of them, and the feet are facing forward, which is good. And I don't see any redness that would indicate inflammation. I do see a couple red spots right here on her foot, but I think that's just from where her shoes were. And I don't see any swelling. I don't see any deformity, masses, or anything like that. So now I'm just going to palpate your feet.
Okay.
Okay. All right. I'm going to feel the ankle. And I don't feel any deformities, no nodules. I don't feel any heat that would indicate inflammation in there. And I'm going to palpate on your toes here. Okay, I don't feel any nodules or masses there either. No heat in the foot that would indicate inflammation. And I am able to easily palpate the lateral and medial malleoluses on both ankles, which would indicate to me that there's no swelling in the joint, which is good. And, all right, they look good. So now we're going to do some range of motion with that. And so first, I want you to plantar flex your feet, which is push them this way. Perfect. Now pull them back this way. Good job. And then can you invert them? So like roll them in. Perfect. Now do out. Perfect. All right. So I see full range of motion with your with those movements, and you didn't have any pain with any of those movements?
Mm-mm.
All right, perfect. And the movements were symmetric bilaterally. And now we're going to do some muscle testing on your ankles. Okay. So now I'm going to have you do the plantar flexion again against my hand. have you dorsiflex against my hand. Good. Muscle strength is at a 5. And now I forgot the muscle strength testing for your knees.
That's okay.
I apologize. So
That's
can we
okay.
do that now?
Yes.
Okay, you can just sit on the edge of the bed here. All right. You can come a little off the bed here. Good. So I'm gonna have you push against my hands. Perfect. And then I'm gonna have you pull against my hands. Perfect. I would also rate that muscle strength a 5,
Okay.
which would indicate to me again that you have full range of motion in those joints against gravity and full resistance with
Okay.
my hands. Okay. So we're almost done here. So the last thing we need to do is your spine. So I'm just gonna have you stand up for me one more time, if you don't mind. Just turn this way. Do you mind if I pull your shirt up at all?
No.
Okay. All right. All right, I'm gonna inspect her spine and her back, and I don't see any redness that would indicate inflammation or injury. I don't see any masses or nodules or bulges in her spine, and I do want to note that her head is midline, and I note the vertical line that goes straight down from her head, so she doesn't have any deformity in her spine. It's straight, it's aligned straight, and her shoulders, her scapula, her iliac crest, and her gluteal folds are all at symmetric levels. And now I'm going to, I'll put your shirt back down. I'm gonna put your shirt down. So I'm gonna turn you sideways real quick, and come out this way. Okay. Now I'm gonna note the thoracic curvature in her spine, which is perfectly normal, and the lumbar curvature here, which is also perfectly normal. And now I'm gonna palpate your spine a little bit, okay? So I'm gonna pull your shirt up again. Okay. Then I'm gonna have you bend over and touch your toes for me if you can. Alright. Alright, I'm gonna palpate the skin. Again, note any heat, note any inflammation. I don't feel any. The paravertebral muscles are firm with no spasm or atrophy there. Now I'm palpating down her spinous processes, and they are in alignment. There's no scoliosis. You can see my cup. No scoliosis, kyphosis, or lordosis noted in her spine, and I didn't feel any swelling in any of the joints. So now we're just gonna do some range of motion with your spine to finish up.
Okay.
So you've already demonstrated that you can bend over and touch your toes, so I'm gonna ask you to do that again. So now could you go backwards like this for me? Perfect. And then can you go left and right? Perfect. And then without turning your hips, can you turn your body and look over each shoulder? Perfect. All right. Full range of motion noted with your spine. You didn't have any pain with that? Any numbness or anything like that?
No.
All right, perfect. So that'll be the end of my musculoskeletal assessment, okay? And you can sit back on the bed, just make yourself comfortable. Are you comfortable? You can put your shoes and
Yes.
socks back on now if you'd like to.
Thank you.
Okay, and I'm just gonna do some hand hygiene. That should be good.
Thank you.
Mm-hmm.